I guess I can start. So my name is Mike Farrell. I am a PGY4 at MedStar Georgetown National Rehabilitation Hospital. I am originally from Buffalo, New York. And next year I will be heading to UPMC to start a pain fellowship.
Hey everyone, I'm Karri. I am from Texas. I'm a PGY4 at Baylor College of Medicine, and next year I'll be doing pain at Johns Hopkins.
Good evening. I'm Juliet Gaisey, originally from Michigan. I'm a PGY4 at Johns Hopkins, and I'm going to UCSF for pain medicine.
All right, fantastic. So we have some questions that were submitted to us. So we're going to start with those, and then please, if anybody has any questions, just write them in the chat box and we will relay them. So for the first question, how long did your interviews typically last?
So I mean, we could probably just keep the same order, I guess, to make it easiest for everybody. But in terms, I found that it was actually pretty variable. For me, there were certain interview days that it was probably maybe two hours on the short end of it. And then there were some interview days that were almost 4 to 6 hours. It felt like it was a very long process. They had you interview with multiple people. There were lots of people in the rooms. So to get everybody to break out and actually be on time and be able to come back, there were some technical things with that. So it was highly variable for me.
I would agree with that. Some people or programs, I think, sort of just try to replicate the in-person experience, and that took up the whole day. But some people adjusted to Zoom, I'd say, a bit more effectively. So cut out the lunches, cut out the unnecessary introduction by person. Just breakout rooms, knock it out. You can get your 5 interviews done in 3 hours or so. So it varies, but I had the same experience. Some lasted the whole day, the whole 6-hour experience, no different than an in-person interview.
So I, again, would agree with the other two. I had early on in the interview process, I had one that lasted three days just because of the faculty arranging their schedule. But I think towards the end of the season, everybody kind of got the new format. So it was less hectic.
All right, fantastic. And what questions can you ask the interviewers to get the best picture of what it's like to work there?
That's tough. I think for me, that came a lot when you were talking with the fellows. Your interviews with the faculty were so short. They were usually kind of on the side of 20 to 25 minutes. And that time goes by so quickly that to really get through all of the things that you want them to know from your app, and maybe some of the things that you didn't include in your app, you're really streamlining your conversation, and you have to become effective at conveying everything in a short amount of time, because that time goes by quick. And then all of a sudden you're moving on to the next one. And because you're not there in person and you don't get that same feedback, you want to make sure that you have a strong outing and that you felt good about it. And so I would really kind of focus on that. Then when you're in the rooms with the fellows, there's a lot more time. So you're waiting around to be pulled into a separate room to do an interview. And so you have quite a bit of time to talk about them, about what is life like outside? Do you guys hang out at all? What is the environment like actually in the fellowship itself? And because there are multiple fellows in the room, you can kind of see them interacting with each other. And I think that gives you a really good sense as to what the camaraderie is like and what they're like as people outside of just their jobs at the hospital. And so that, I think, was my biggest takeaway. And the places that they've seemed to be the most comfortable with each other, that those were the places that I tended to kind of get that same feeling that I got on residency interviews, that I could see myself doing well and succeeding there.
Thank you. Would anybody else like to add anything?
Ditto. Nothing else to add, really. The residents are the ones you really want to get that question answered from. There's always going to be socials or lunches or whatever, a little more of an informal setting. And a lot of places actually gave me the residents' like fellows' cell numbers and just asked that we, conveyed and had a conversation outside the interview process. And, these things are all helpful just to get to know them a bit more in an informal setting and understand their day-to-day.
Yeah, for me, I think I asked every single person that asked if I had any questions the same couple of questions. I asked, what are the strengths of the program, or what are you proud of your graduates for doing? If you could change one thing about your program, what would it be? Just because, one, if you have several different interviews and different interviews say the same thing, then it's true. They're not just saying things. And, there are some programs that couldn't name anything that they would improve, which I guess also says something about, the progress of the program. And I think, I asked the fellows probably the same question. And then the attendings, if I had time, I would ask them, what advice would they give an applicant like myself? And that to me tells me how they felt about me as an applicant, and if they really thought that I would be a good fit for their program. And so I think those are really like broad questions, but it really helped to ask the same question at each program, so you can compare. You had something to compare them to, and they almost always ask you, do you have any questions? And so sometimes you don't have any questions, so it's nice to have those in your bucket list. Just
Fantastic, thank you. And virtually, were you able to get like a good sense of the fit?
I don't know if anybody else wants to like answer first. I feel like I don't want to steal the opening opportunity to make comments.
I'll go first. No worries.
There you go.
So talking about fit, yeah, that's a good question. Maybe a little different for fellowship because this is only 1 year, and I felt like it was a little less important than for residency, where maybe 3 or 4 years. And I think it's a more meaningful question to try to answer. But my advice would be, once again, just try to talk to the residents and fellows, and just try to see what their day-to-day is. It doesn't have to be at work. It can be, outside work, how they like the city, how they like the program and each other. I think those things really can be quite telling as far as what their experience is like as a whole.
Yeah, I would agree with that as well. I don't think that, going on a tour of the clinic rooms has ever made me rank a program higher or lower, or, I know they like to show you all the different features and things at their facilities, but for me, that's not really what's important. What's important to me is how happy the fellows are when they're having the conversation with you over Zoom. And you can tell that in person, and you can tell virtually. There's some fellows that came and they were clearly exhausted. And there were some fellows that, they worked hard, but they also had fun together. You can ask directly, like, what do you guys do for fun? I think going forward, I hope we continue to do some of these interviews virtually, because it saves so much money and time.
Yeah, I would have to agree with everything that everybody has said so far. And the one thing that I would add is, I think for most of the people in the room, you're a student going into residency, and so you may not know yet how important the program coordinator is in your residency program, and likely how important they're going to be in your fellowship. And you spend a lot of time communicating with that person. And some people, I got an impression that they were very rushed, very busy, very stressed, very anxiety provoked. And that to me kind of made me think, okay, well, when I interview, I'm going to try to look and see is that same type of feel coming from the fellows. And for a lot of the times it was. Whereas when the programs coordinators felt very warm, they felt very supportive, they were willing to kind of be flexible, you got an idea of what the culture was like there. And so I would definitely say that the program coordinators, they can give you a lot of insight into kind of what the heart of the program is going to be like.
So, what has the biggest challenge really been in interviewing virtually been for each of you?
Okay, I guess I'll go first. So first, I guess to give you a background, I gave birth like right before the interview season started. So I was on my maternity leave, which was a blessing because I didn't have to go to work. But you know, my daughter's at home. We had a babysitter, so we had the crying in the background. So I think the biggest challenge for me, not just with her, but there's a lot of background noise that you can't control. I did a lot of Amazon shopping in the beginning of this pandemic, and we have the Ring doorbell. So turn your doorbells off. I think one of the interviews, FedEx came, then UPS came. It was a disaster. So finding a quiet place to do the interviews was challenging. Another thing, well, I guess that wasn't really a challenge. I think the internet was an issue once, but there's nothing you can do about it. I had a setup in my basement where there was two like nice university graduate certificates behind me, and then I sat down, but there's just not good internet. So check your internet wherever you're doing these interviews. Make sure you have secure, good internet in that spot.
So like we mentioned, a lot of our interviews are, half days or even score of 2 to 3 hours. So I took a lot of interviews without taking off time from work. I would just go back to work in the afternoon or go to work in the morning and do it in the afternoon. That was probably a mistake for some interviews. I would say that even though it's virtual and it's easy to just allocate 2 hours out of your day, I would say the cognitive load is pretty impressive, even if it's a 3-hour time commitment. Just smiling and engaging in conversation sometimes for 3 hours is a lot to ask for. So especially for those interviews that you're more excited about, take the day off. Try to get off best you can. Obviously, budget your time wisely is one piece of advice I would say I would have appreciated.
Yeah, I think for me, the big thing, I'm 1000% a talker, and I love to interact with people, and I feel like I can get a good sense when I'm with somebody and I'm having a conversation, whether or not that feeling is mutual, that they're enjoying the conversation and that they're fully invested. And a lot of those nonverbal cues that you usually pick up on when you're having a conversation with somebody in person doesn't happen over Zoom. And that's really tough when you're giving an answer because you're used to getting some sort of feedback from the person in terms of how they're receiving it. And so that was a big challenge for me at first. And as I went on, I think I got better at that and kind of realizing that you just have to power through as much as you can and get on to the next question. And that's tough. So I think that was probably the biggest challenge, was learning how to kind of talk in front of the camera and learning how to, have a conversation without somebody actually sitting in front of you and have it seem natural because, so hopefully a lot of you are doing Zoom something for class or something like that, and you're getting used to that. If you're going to be doing conferences in the future or poster presentations, you're probably going to be doing that virtually. So it's not a bad idea to kind of get used to rehearsing and answering questions, sitting in front of your computer with other people around, with other people not around, all those things to just make you really comfortable. Because you want to come across your best when you're in that situation.
Yeah, and continuing on that theme, do you think it's worth spending money on webcam, microphone, lighting, the works?
So, I mean, I'm sure some of you can probably tell that I have definitely done that, but I want to preface that by saying that this was not done specifically for interviews. And it can be a very expensive investment to try to, go down that route. And there are much things. So, just getting a good webcam, could make all the difference in terms of, what you're looking for. Getting a Yeti Blue USB microphone that can make you sound as though you're in the room may give you more confidence. It may, make you know that you're putting out your best thing forward. Or you could go all out, and if you have some of the gear and you have a DSLR camera or something like that, you can get a capture card for your camera and you can set something up that's kind of similar. I had most of this equipment, so it was all just a matter of kind of wiring it together and getting the capture card. Do I think that it made a huge difference? Not really. I mean, I think that the truth is it made me feel more like confident and comfortable, and I knew that everything was going to look good and come across good. But in terms of my actual responses, I don't think it swayed anybody one way or the other. I think that it's your responses and your personality and everything that's going to come across. So, just know that it can be an expensive investment. If you're going to use it for other stuff in the future, then by all means, but I don't think you need it.
Wow, I'm shocked. I thought your answer was going to go the other way. But yeah, so Michael talked about some of the positives. I will say the more impactful thing would be to, keep away from the negatives, make sure your internet works, your webcam and microphone are in good condition and works. Nice background, quiet environment, no extraneous distractions. I think that'll be, the most impactful.
So I guess my short answer is no, I don't think it's worth it. But the only thing is, you need a camera. So if your computer doesn't have a webcam, then absolutely purchase a webcam.
All right. If your computer doesn't have a webcam, can you use let's say like your mobile device or your tablet or something like that?
Yeah, one of my interviews, I actually think one of the anesthesia residents was either in the OR or something was happening, because we were like watching them set the phone down and looking up at like a light in like a surgical looking suite. And then they were like all of a sudden in a different room. I had no idea what was going on, but there were definitely people who were using cameras, camera phones, iPads, things like that as they were kind of moving around in the hospital. They were great. So I don't think that's a negative. I don't think it's anything that you have to worry about.
Okay, fantastic. Thank you. And the next question, which is our last interview specific questions. Again, if anybody has any other specific interview questions, just write them in the box. But so what are some of the toughest interview questions that you've gotten?
Mine was for residency, I think. I still remember this. One of the faculty members of this program said that it was really important for you to be self-critical and assess yourself. And he asked me to predict, I think, 3 keywords that were used to describe me in my letters of recommendation. And, I obviously panicked and just picked 3 generic things, and luckily they were there. But yeah, I think that was the hardest question I was asked. I don't know that. I guess my meaningful advice to come from this is that you'll be asked hard questions across the trail that you cannot prepare for, and that's just sort of the nature of this process. But I think it's okay to be human, to take a deep breath, to take a step back and say that's a good question, and approach it systematically and methodically. I think that'll be impactful. You know, you don't have to hit a home run, but seeing the process, I think, is important.
I interviewed at one program that had this like really different format, and the questions were they just seemed to be so random. It was like, you have 2 pieces of fruit and 3 people in the room. How do you decide who gets that 3rd piece of fruit? Like, or 2nd piece, whatever. And then the follow-up question would be like, do you believe in peace on earth? Like, the questions were so abstract, and I was just so stressed out that my answers were like, they clearly reflected how I felt about the interview. Like, why are you asking me these questions? Like, tell me about your program, ask me about who I am. Anyways, I did not rank that program very highly, and it was difficult to understand what type of program they were with this weird format. I don't know if either of you interviewed with them.
No. I would have definitely remembered that question.
It was, yeah. One of them was asking about surrogacy and how it's cheaper to hire a surrogate from another country. Do you believe that this is okay to pay somebody a lot less to be a surrogate in another country? And I'm like, I've prepared for every question, you know, like, why are you asking me this? So that was my most difficult interview overall.
This was for pain, or?
This was for pain. Exactly.
Oof. Yeah, I definitely did not get any questions like that. I mean, I think you're always going to get hit with something that you just didn't plan for and didn't anticipate. I mean, the one that kind of threw me, I think it was like the way that it was asked was, what is someone's biggest misconception about you? And I was like, you know, your first instinct is to like just blurt something out because that comes out of nowhere, but you really have to kind of like think about it. And I think, you know, as Jay was saying, you really have to like take a deep breath, say, that's a really great question. And then give yourself a couple of seconds to think about it, and don't just blurt. Cause like, you know, you might be heading down a path that something that you don't necessarily want to talk about or bring up, or, you know, something. So I think that was probably the toughest question. I did not get anything about dividing up fruit though. And I'm so glad that I did not, cause I don't know what was that. In terms of the common questions, there was a document that someone shared with me that was one of our sports fellows who's at Mayo Clinic this year. He passed that along to me. I have that. I can pass that along to one of you guys to distribute to everybody if you want it. And then I just went through and kind of filled it in. And it was like common questions like, where do you see yourself in 5 to 10 years? Why do you want pain? What are your greatest strengths and weaknesses? And I kind of went through, and those were the things that I rehearsed in front of the camera, because then at least you have those kind of like softball teed up questions like down, you know, the things you want to talk about that highlight and emphasize your application. And then I also have a document that has a couple questions, specifically questions for the program directors. Like, what should I be doing now to prepare myself to become a fellow? You know, kind of questions that show that your ability to grow and those types of things. I'm happy to share that with you guys as well to pass along. And then there was also the questions that were like specifically for fellows, which were the nitty gritty questions of like, how many pumps and stims did you guys put in? And the things that you're not going to ask the program director. So those are things to kind of like think about when you're thinking about how to ask questions and do this stuff, is what things are appropriate to ask the faculty and the PDs, and then what are the things that you want to kind of save for the fellows. So I can give that to you guys as well.
Sorry, I was reminded of another tough question. So this was my hardest question during the pain application season. Not sure if either of you had it, but it was a panel interview with 2 or 3 faculty, and they're presenting a case to me, and they're asking me step by step what my thoughts were and how I would react and, you know, move the case along. Essentially, it was a very bread and butter case, but it became very obvious to me very quickly and early that they didn't really care about the answers. They wanted to just see my approach to it, because they're just grilling me. They're trying to be me. They're trying to shake me down. And, you know, it's just to see what my composure was like. And I think, I don't know if residency's provided you with any cases. I don't remember, but they may provide you some ethical questions or something like that. But just remember that sometimes it's not about the end point, it's not about the answer, but rather how you get there.
Yeah, I did have one of those case type questions for residency interviews that I specifically remember for PM&R residency, and it was like this: you pick one of the three. I don't know if any of you interviewed with this program, but that would probably ring a bell. Pick the three. Do you want a stroke case, a TBI case, or a spinal cord injury case? And then they presented you with this, and they had you kind of go through your thought process. And I walked out being like, I don't know how I did, but again, like you said, I think they want to put you on the spot, and they want to see how are you able to kind of like break down a problem and then logically work through those steps, because you are not supposed to know everything. Like we're applying to be fellows. We don't know everything that there is to know about pain. They don't expect you to, but they want to see that you have at least an understanding and can kind of think through and problem solve. So, no, neither of you got that interview question for resident? Man, that's tough.
I did have one where they said, give an example of a procedure, and then they like presented an example case, and they said, how would you adjust your needle if this happened? Wasn't that bad though.
Yeah.
Yeah.
All right, so we have a couple of questions in the chat. So let's see here. So what is a good way to highlight your weaknesses during the interview if you're asked?
I feel like I've gotten so much advice from that over the years of people saying, you always want to make your weakness one of your strengths, and talk about something. And although I tend to agree that you always want the answer to come out, I think that sometimes it can come off as disingenuous if you take that route of saying like, my weakness is I'm a perfectionist and I do, I work 1,000% on everything. They can kind of be like, I see through that. There's no way. I think it's better to be honest with yourself and think about what are the things that are your weaknesses, and then think about how you've actually worked through them to make them better and make them be something that is your strength. Because being, that ultimately that's what you're going to be doing as a fellow or as a resident. You're going to be recognizing your own weaknesses as a physician, and people are going to be pointing them out. And then you're going to have to find ways to turn that around. And I think that's what they want to see, is that your ability to recognize your own weaknesses and improve them, not just not have weaknesses. We all have weaknesses. So I would say, instead of trying to think of a weakness that's a strength, think of a weakness that you've had, that you've worked on and improved, and maybe something that you did to help you. So like, I have a tendency to take over. And so in a teaching scenario, that might not be the best thing. I might not allow that person to get to the answer. I might just kind of like help them to it. And so what has helped me to become better at that and try to be better, because that's going to be my responsibility as a fellow, is to teach some of the residents. I joined the teaching academy at Georgetown, and I've been attending some of their lectures about the best ways to try to teach and be a better teacher and learner. And so, this is something that I'm working on and I'm hoping to become better at. And so it was able to show a strength or something unique about me, but it's true. That is a weakness of mine that I am working on. And so I think that comes across as being much more genuine than turning your weakness into a strength, or saying that your weakness is an actual strength, I guess, in a roundabout way.
Great, thanks. I mean, in the chat, there's one more question, and I'm just the messenger here because I know you said, make it genuine, but there's a question by Zora saying, is there a good source you can recommend to prepare those type of cases or questions?
I mean, I don't I don't know if there's any specific reference that you'd be able to read through and know every single case. But what I would, if everyone in here is applying for PM&R residency, then I think what I would do is try to think about what is it that physiatrists are really focused on and what are they trying to do, and then make sure that in your case you address those points. So we know that physiatry is really kind of physicians that try to help people who have had a medical problem get back to functioning. And so making sure that whatever case you picked, that you helped to address and talk about what are their functional limitations for all the things that they do with their ADLs and IADLs and those types of things. And I think that if you were able to answer the question that way, that would be more than enough, in terms of they're not expecting you to be able to like regurgitate specifically what you're going to do for secondary stroke prevention and all of that stuff, but they want you to be able to logically think through, like, does this person have difficulty with swallowing? How are we going to get them nutrition? And I would consult nutrition to be able to do those types of things. So I wouldn't necessarily go to try to study every case that you could possibly come across, because this was one interview out of many. And that's going to be a lot to take on. But I would at least just think about, kind of from a PM&R perspective, what are the important take homes, and be able to at least talk to those things.
Great, thank you. And now I have a question from Carter saying, did you feel like you gleaned enough info from the virtual format to be able to rank programs comfortably, or would you prefer to visit the program in person?
I think it depends on the program. For the most part, I think I was able to get most of what I wanted to comfortably rank them. I didn't feel like I was missing out on anything when it came to ranking, but it would have been nice maybe to be given the opportunity to visit some of the programs that I was really interested in. I don't know if COVID will turn around, or the situation will turn to where second visits will be a thing early in 2021. But I think if given the option to go to your top few places, that could be helpful.
I guess for me, especially when I compare it to interviewing for PM&R, I don't think that any of those flights were worth it. I don't think that walking around the hospital changed the way that I ranked the program. I think in this virtual format, what I thought was important was that conversation with the fellows, and 1 or 2 hours was enough. And then getting to know the program director, which you can do virtually, I just couldn't justify the cost of flying to even my top 4 or 5 choices. It just seems unnecessary, in my opinion.
I thought the programs did a good job. A lot of them had videos to kind of give you somewhat of an idea of what a day would be like, what the rooms look like, the clinic looks like, all the stuff that you can't do. I think if we're all being honest, the chance to be able to go to every program would be wonderful if somebody else was footing the bill and allowed you to actually be there in person and see the city and the town and all that kind of stuff. But to be honest, I didn't feel any different, I guess, from residency when I did actually get to visit these places. I felt like I had a good enough information to make a decision, and it felt really good to not have to spend that money. So looking back on it now, so I guess, it's a double-sided sword. I would say that sure, it would be great to see everywhere in person, but the money that you get to save, I think you get enough of an insight into the program, and you can, I don't know, spend that money on a nice dinner for yourself or something.
All right, thank you. Thank you so much. And now we have a question from Rocco saying, did you favor smaller or larger fellowship programs, and why?
I don't think that the size of the program necessarily was my first thought. That obviously came afterwards in thinking about strategically, like what programs, would have the most number of openings. And especially with COVID, the thought was, are the programs giving out enough interviews to be able to fill up those spots, or are the same people kind of gobbling up all of the interviews? And how is that going to shake out? Are they favoring, home applicants and people who were in that home program? And so those types of things kind of seem to get into my head more than the size of the fellowship necessarily. And then obviously, like, the location is going to be clutch for, I think, for residency and for fellowship. I mean, people can say that it's not, but that definitely plays a huge role. And then from there, you start looking at all the intangible things, the things that the program does well, or that they're known for, or that the fellows kind of talked about that check boxes for you and for everybody. I think that's different. And it's those intangible things that I think will move programs around once all else is equal.
I would say it depends on what kind of learner you are and what kind of, I guess, person and feel you're looking for. I had some programs where there's like 2 fellows and it's very intimate, and you work with the same few attendings and you get a lot of longitudinal growth that way. And for some people, that's how they learn and that works well for them. I'm from a massive residency program with Baylor and UT. We have 36 residents, and I think that's an asset for us. I love working with my co-residents. I definitely learn a lot from my attendings, but I learn just as much from my co-residents, and I think it amplifies my growth as a trainee. And so when I was looking for fellowship programs, I wanted someplace that was large. And so that is something that I chose, but I think it depends on everyone else, or it depends on your interests.
Yeah, I think I favored larger programs as well. I think just first I was looking for an academic program, and I was looking for someone or somewhere that I'd have the opportunity to be involved in, different workshops and go to different conferences. And it seemed like where there's a program with 2 or 3 fellows, it's difficult for them to keep going without you. Your sick leave or vacation or CME days, it just seemed like it'd be difficult to do in a smaller program.
Yeah, that's huge. I fully agree. I think I have friends in smaller programs, and it's an act of Congress to really get sick leave or vacation changes. But yeah.
Great, thank you. And now we have a question from Toa saying, how did you assess how programs promoted diversity and inclusion?
Well, they're video interviews, so I did have interviews where people asked me directly, because George Floyd and everything was going on. So that's probably a unique experience that you guys probably won't have. But you can tell not just diversity in terms of race or gender, but in diversity of faculty, meaning having different specialties, junior faculty, senior faculty, and those types of things. You can all glean on virtually through video interviews.
Yeah, I think a lot of the fellowships too, they had kind of publicized their rank and who they've had as fellows for the past at least couple years. I feel like you could go back and you could kind of look through. And I know that someone from PM&R Scholars kind of asked, is there a way that you can kind of set yourself apart as a physiatrist? One of the things that I would always look back on is to see what is the breakdown, what's the shakedown of this fellowship, and how many anesthesia residents? Is it kind of a toss up? Is it strongly anesthesia with just a few physiatrists coming through? And so in that, when you're looking back through and you're looking at the former fellows, you tend to get a good idea of like, oh, they mix it up pretty well. There's a lot of different people all coming together. That was something that was very important to me, was trying to go somewhere that was multidisciplinary and that had kind of insight coming from all over the place. And so that's probably the only real way, unfortunately, with the video, that you could really kind of do a formal assessment of their diversity and inclusion, I guess, because they're kind of choosing who they're putting in front of the camera to interview you. And so I think, I mean, that was something that I did, was just go back through and try to look through the past fellows and kind of see what was the mix like, and kind of where do they lie on that spectrum. And there were definitely programs that had some preferences, and you could see that in their fellows. And then there was, programs that seemed like they just took the best applicants, and I tend to gravitate towards them.
All right. Anybody else want to add anything more? No? Okay. All right. I'll move on to the next one, which is, so how did you show interest for your top choices?
Can you repeat that, please?
I'm sorry. How did you show interest for your top choices? And then there's another question about also letters of intent. So I think they kind of go together.
You guys correct me if I'm wrong, but I feel that, the interview day is pretty comprehensive. They do a pretty good job at, looking at you holistically as an applicant and as to what kind of fit you'll provide the program. I mean, I've obviously sent my top couple programs, my, intent to rank them highly or whatever, but I really think that the needle really doesn't move too far with these things. That's just my opinion, at least for fellowships. I think that, just based on where the match is, it behooves them to rank based on who they favor.
For me, I think that was part of the reason why I asked those same questions, because oftentimes you can ask that question of the fellows and they'll tell you, what are some of the strengths of the program. And if there are strengths that you're, looking for, or strengths that, would gear you towards going to that program, you can share that when you go through the interviews and say, I really like that you guys do X, Y, Z. And I think that giving specific examples allows you to show that you're, taking that interview seriously and are very interested in that program.
Yeah, I mean, for both of those, how did you show interest, and did the programs accept them? So both myself and my co-resident who applied for Payne sent out emails to our top programs. And more or less, do I think that helped at all? Probably not. But what that I think is going to come down to is, I would never want to look back if I didn't match and wonder, would sending that email have made a huge difference? And would that have really moved me at all? I don't really know. And I would rather always be proactive than to be reactive. And so for that, my own personality, it made me feel better to send that email. But the responses that I got back from, my top 3 programs ranged from very generic and kind of defeating almost, because you get that email back and you're like, ooh, I don't know how that's going to go, to very uplifting and very positive, which was a good feeling. And I even got a phone call from one of the emails that I sent out. And so, does it move the needle? I don't know. I think that you probably have to be in their top, percentage anyway. And that then sending that email may make them go, oh, well, maybe they're really serious about it. And then that may, but I don't really think that email is going to necessarily do anything. The only thing it did for me was make me feel better. And ultimately, at the end of the day, that's why I did it, because then I could sleep at night and barely sleep at night, but sleep at night before the.
We actually just had this conversation, myself and one of my co-residents, about sending thank you emails to everybody who interviewed, and how that affects your rank or whatever, or does that influence your rank? I just, even if it does, it just feels too fake to me, you know? So I couldn't do it. At the end of every interview, I clearly said, you know, I really appreciate you spending this time to, you know, to interview me and to talk to me, which was genuine. But to send an email so that hopefully I end up higher on their rank list, I just couldn't, it didn't feel right for me. So I didn't do it.
Yeah, I think if you try to write an email to everyone that interviews you, you'll find that after like the second or third one, you're like, I don't know what to say to this person. I literally talked to him for 20 minutes. There's nothing meaningful that I could really say. Sending maybe one final, like, hey, to your top 2 or 3 programs, like, look, after all that I've done, I've given it a lot of thought. I've compared you to everything and you're at the top of my list. That's an okay, I think, thing to do. But even as a resident, you know, like I've had people, you know, send thank you cards and do stuff like that. And like, it's a nice gesture, but it's not going to really like ultimately change anything. And I think, you know, now that we're applying for fellowship, we know that as well. You know, and it does come across as just kind of like, really? Like what it, but if it makes you feel better, I don't know. Whatever's gonna keep you sleeping and energetic and full of vibrance, so that when you're on your interview, I don't know if sending out letters does that for you, then go ahead.
All right, great, thank you. So next one we have is, I'm sorry, I skipped this one from Sarah. Did you have a lot of questions about COVID, and how would you have handled the situation? Oh, I'm sorry. And there's also something about questions about the future of medicine and healthcare. I don't know if you can all see it in the chat.
Yeah, I think Sarah actually has 2 questions. It looks like kind of back to back. One was about COVID, and then the other one was about inappropriate questions. Really
That's
briefly.
Right.
So COVID, you know, they talked about how they were handling COVID, but I did get one question, you know, about how COVID has impacted me in terms of residency and training and those types of things, but that was about it. I don't really remember any specific questions that got into like the politics or anything of a vaccine and all that kind of stuff. And I had 0 inappropriate questions about politics or anything like that. They were all very professional questions.
Yeah, I think a lot of the programs, just as a way of making small talk, were just like, you know, how's it going in Baltimore? Yeah. You guys okay? You know, how is this affecting your education? It just came up because that's what it was on everybody's minds.
Okay, Dr. Karri would like to add something to that? No? Okay. Okay. All right, so now we have another question from Carter. Did you consider applying for a similar fellowship, such as a non-accredited one, let's say an interventional spine, MSK? Why did you end up in pain instead?
For me, yes. I initially came into residency thinking that I wanted to do sports and, you know, a little bit of spine. And so the interventional spine MSK fellowship seemed like a good option. However, the more that I did sports, the more that I did on-field coverage stuff, I was kind of like, this isn't really what I had anticipated. And so then I was kind of thinking, well, do I do interventional spine or do I do pain? And ultimately, what it came down to for me is the 2 biggest reasons. The first one is I was hearing that there are some surgical centers that will not actually credential you to be able to do procedures if you do not have an ECGME fellowship. And so interventional spine and MSK fellowships are not ACGME accredited. Some of them are NAS accredited, but they are not actually accredited by the ACGME. And if you are working in a location where the surgical center will not credential you, you cannot do the procedures that you were trained to do, no matter how great your training actually was or was not. So that is the first thing that kind of made me a little bit nervous. The second thing was that the training is so highly variable for the interventional spine and MSK fellowships that it's hard to know when you're done what your skill level will be. Some of them are excellent in teaching the interventions, and some of them it can be hit or miss. So for me, I knew that I wanted to, when I came out, have the skills to be able to do whatever intervention comes along. And whether that's something like a percutaneous decompression, or whether that's doing an SI fusion, or whether that's doing just traditional epidural steroid injections, I want to have the skill set to be able to approach any of those interventions and now and in the future with a solid, sound foundation. And I believe that the only way to really do that is to do a ACGME accredited pain fellowship. And so for me, that was those two reasons were why I opted to do pain.
So I was interested in academics, and so I couldn't find any people who went into the non-accredited fellowship who did research. I know that they exist, but it seemed to me like a lot of the people who were in academic medicine were accredited. The other thing is I also don't want to be in a situation where I can't move to West Kentucky or wherever because my fellowship that I did only is recognized in this part of the country. So I wanted that certificate. I wanted that safety net stating that I was trained to do X, Y, and Z, and and I think that there's a big difference. So I started off, I think, PGY 3-year, trying to decide between the two. And there's a big difference in the way, at least in our program, they treat patients and they approach patient care. And one is clearly more academic. So that's why I chose pain medicine.
It's a tough question. I think it's getting tougher because there are some good non-accredited programs that are getting even stronger. I mean, Dr. Furman, he runs the non-accredited spine program in, I think, Yorkville, Pennsylvania. And that's the book that every program in the country uses, accredited or not, Harvard, whatever else. And his program's fantastic. But at the end of the day, like, Michael alluded to, if it keeps you from getting a job, because if you're credentialing and whatnot, that's just a hassle I don't want to deal with, especially since I wanted to do academics. So for future prospects, I didn't want to, get a headache 30 years down the line. So I thought I'd just be safer by doing accredited fellowship.
And I think, for you guys that are in medical school, if you do end up doing a pain rotation, it sounds like, Carter, you're already at Ohio State. So, you have to look at the types of procedures and things. I think, Dr. Furman's fellowship is probably like unique in the sense that it is so interventional. But there's a lot of interventions that I think, pain physicians in particular will do that most interventional spine and MSK trained physicians would not. And so you just have to think about, do I even have any interest in doing those things at all? And if you do, I really think that, you have to strongly lean towards doing ACGME pain and not thinking that you can do interventional spine at one of these, places and kind of backdoor your way into that. Because I think it's going to, as they've already talked about pain fellowships becoming 2 years, as the procedures get more and more, interventional and surgically heavy. And so if that's the case, I think it's going to be harder and harder for interventional spine trained docs to be able to get that credentialing and do those types of things, and do some of these other interventions.
jobs aside, I've even heard that insurance reimbursements can vary, especially if you lack credentialing.
Right.
You know, and 20 years down the line, you don't want to deal with this.
Yeah. I see the next question is, what is the benefit of an academic job over a private job? Well, obviously with the academic job, you're usually split between hours that you're teaching, hours that you're spending with residents, hours that you're doing research and admin time and those types of things. And your interactions with residents and with trainees is obviously going to be much heavier in an academic setting. I think, to me, those are the biggest benefits. Is there's less of an incentive for fee for service, so you don't feel the pressures to maybe see the volume of patients that you necessarily would in a private clinic, and then also the interactions with the residents, and being able to kind of focus on teaching.
Okay, I'm sorry to cut it short. I don't want to keep everybody past 9. I wanted to thank the 3 of you really for taking the time to do this. It really helps a lot. Any final words of wisdom would you like to share?
Be yourself. It doesn't help you at all to be someone else. Match with the program and be unhappy. Good luck.
Thank you.
Yeah, no, congrats. You guys picked an exciting field. We're reviewing applications for our program, and I'm always continually impressed at how much stronger the applicant pool is every year. You guys are a fantastic group, and yeah, I echo Julie's sentiments. Just be yourself and be confident, and good things will happen.
Yeah, same, guys. I mean, if you're having the interview with them, they've already gone through the hard part of being screened out. So you've already passed all their qualifications to get in and be in that seat. They're not going to waste their time interviewing people who they don't want. And so at that point, really just consider it your spot to lose, and just be yourself, and talk about all the things that you've done and the things that you're passionate about. And ultimately, I think you'll end up at the right place for you.
All right, thank you so much. All right, so we have a survey, by the way. The survey link is in the chat box if you can fill it out. And again, I wanted to thank the 3 of you. Thank you for taking the time to answer these questions. It really means a lot. And to everybody, just stay safe. And thanks for tuning in.